Assalamu alaikum. Hope you all are doing well. Starting with the name of Almighty Allah, who is the most gracious and merciful. I am Hafsa Islam, roll number EP17700047 from University of Karachi, 4th year pharmacy. As I belongs to group number 19, so the topic of my presentation is alcohol use disorders. As you can see on the screen, the content I will be covering under this main topic are alcoholism, what actually alcohol is, what are the alcoholics or the categories of drinkers, risk associated with the use of alcohols, how to calculate BAL, that is blood alcohol level, pharmacokinetics of alcohol, medications that we can use to treat alcohol abuse or the withdrawal symptom, adjunct treatments, other drugs therapies available, and in the last we will study a case related to the alcohol use disorder. First of all, I would like to share with you people the definition of alcoholism, or who are the people called as alcohol addicts. If we talk about the definition given by American Society of Addiction Medicine, alcoholism is a serious condition leading to major psychological and physiological consequences. According to the Diagnostic and Statistical Manual of Mental Disorders, that is DSM-5, defines alcohol abuse in a combination with alcohol tolerance, dependence, and withdrawal. Before going towards the pharmacokinetics of alcohol, first we need to understand what actually alcohol is. As we know, the alcohol is produced by the fermentation process, and the total percentage of the alcohol in any drink depends on the amount of the sugar provided to the yeast during the whole process of fermentation. The amount of alcohol in any beverage is listed in terms of ABV, that is alcohol by volume. According to the United States law, any drink containing up to 0.5% of alcohol is considered as non-alcoholic. Here in the picture you can see the regular beer contains 5% alcohol, malt liquor contains 7% alcohol in it, 12% alcohol is present in 1 table wine, and the highest amount, that is 40% alcohol, is found in whiskey and vodka. Categories of alcohol drinkers. American Society of Alcohol Medicine categorized the drinkers into two main classes as binge users and heavy users. Binge users are those who are taking 2 or more drinks at least once in past 30 days, while the heavy users are those who are more addicted to alcohol and take 5 or more drinks at least on 5 different occasions in past 30 days. The use of alcohol is more common in American countries as compared to Asian countries. Now you can see in the graph, the use of alcohol is profound in young individuals more. The increased ratio of alcohol also representing the preference of alcohol use in young individuals over other addictions like tobacco and marijuana. Now look at the risks associated with the use of alcohol. These may be acute or chronic in nature. If talk about the acute effects, the use of alcohol produces sedation, loss of coordination, loss of consciousness, slurred speech, and if taken in higher doses greater than 300 mg per deciliter, there may be coma as well. Tolerance and dependence are the main effect of chronic use of alcohol. The use of alcohol severely damages liver, leading to cause cirrhosis and in the end, liver failure. Wernicke-Korsakoff syndrome develops due to the abnormal decreased level of thiamine in brain. Cardiovascular disorders are also associated with the use of alcohol, such as cardiopathy and hypotension. Before starting any therapy for treating the toxic effects of the alcohol misuse, it is a core duty of physician to first know the level of alcohol in body, called as BALs. These BALs will be expressed in either percentage or milligram of alcohol in deciliters of body fluid. You can see on the screen these steps are given for the calculation of BALs. First, you need to determine the body weight of person. Convert this body weight of person from pounds to kilogram by using the factor 2.2. Adjust the body weight of individual, then determine the milligram of alcohol present in body fluid. Divide this milligram of alcohol to mLs of body fluid and multiply the factor by 100 to have the wealth in percentage. Now have a look at the pharmacokinetics of alcohol, how it is metabolized and absorbed in our body. First, the absorption of alcohol. The absorption of alcohol is not a big problem for our body, as it is rapidly absorbed in small intestine because of the increased surface area of small intestine, and not mainly affected by any kind of food or the diet taken by an individual. But the factors that slow down the gastric emptying can delay its absorption. That might be any food or drug. Metabolism of alcohol is mainly carried out in liver, producing dangerous metabolites leading to conditions like oxidative stress and other toxicities such as increased level of acetic acid, fatty acids, and ammonia. Pharmacological interventions for alcoholic persons. Disulfiram, naltrexone, acamprosate are used in most of the cases. Disulfiram is a drug that inhibits the acid aldehyde dehydrogenase enzyme that we know decreases the level of acetic acid in blood. Headache, acne, skin rashes, sore tongue are the most common side effects associated with disulfiram. Secondly, naltrexone is mainly the drug of choice in alcohol use. Naltrexone is a strong opioid receptor antagonist having long duration of action. 50 mg dose should be given to the individual orally or IV. Acamprosate. Mechanism of action is unknown, but it works by decreasing the level of craving for alcohols. Here we have some adjunct treatments for alcohol-related disorders. As we know that the toxicity in case of alcohol use is associated with the decreased level of different biochemicals that are occur due to the use of alcohol. So along with the suitable medications to treat the symptoms of alcohol withdrawal, a person should also need to have some adjunct treatment as well. In the adjunct treatments we have IV fluids, thiamine infusions and other drugs as well. IV fluids. IV fluids of electrolytes will be recommended in patients with low level of potassium and water. Thiamine infusions. Thiamine infusions along with the glucose is necessary if the patient has decreased level of thiamine in blood and he or she is at high risk to develop Wernicke-Korsakoff syndrome, characterized with confusion, loss of coordination. IV thiamine in a dose of 100 mg IV would be given at day first to the patient, followed by 100 to 200 mg dose for 30 days. Other drugs like beta blockers, alpha-2 adrenergics, antipsychotics, and anticonvulsants may also be used as adjunct depending upon the symptoms developed by the patient. Supplements like vitamin C, D3, omega-3, glutamine, N-acetylcysteine, magnesium, L-threonine can also be recommended in some patients. Other than disulfiram, naltrexone or acamprosate, the new drugs like topiramate and baclofen can also be used in alcohol dependence treatment. First of all, topiramate. Topiramate can work by multiple mechanisms, mainly increase the inhibition of GABA A, decreasing the level of dopamine in midbrain, causing decreased euphoria. Now, baclofen. Baclofen works by balancing the presynaptic inhibition and excitation produced by GABA B receptors, treating the euphoric effect in patients. It is also used to decrease spasm and muscle tightness. The case study we will discuss here is based on the use of adjunct along with the medication that we use for the alcohol withdrawal symptoms. Here the patient WW is a 48-year-old male having 230 pounds weight and 73 inches height. He is an alcohol addict. He is not responding on naltrexone, disulfiram or acamprosate, having increased level of alanine transferase, aspartate transferase, glucose and bilirubin. Taking topiramate currently 300 mg per day and having 10 drinks per day as well. This time he is feeling needle-like sensation in arms and hands. You have to recommend other drug of choice with the reason why he is having the sensations like needle. Making the soap note, we know that the chief complaint of the patient is that he is feeling pin-like sensation in his arms and hands. Talking about the history, he has already tried disulfiram, naltrexone, and acamprosate. So he has developed the tolerance for these drugs, so we can't prescribe these drugs to him. He is currently taking 300 mg topiramate and also having 10 drinks per day. His lab finding indicates the increased level of liver enzymes, showing the abnormality of liver as well as increased level of cholesterol and glucose. Assessment. If we assist, then we can say that tingling sensation in hands and arms is called as paresthesia that may be due to the liver enzymes or indicating withdrawal symptoms. But this paresthesia is more likely to be the side effects of topiramate use that he is currently using. Other side effects that are related with the use of topiramate are depression, confusion, slow thinking power, development of kidney calculi. So topiramate should be suggested with great precautions, like patient with renal problems suggested to intake plenty of water and should not be prescribed to hypersensitive individual as well as pregnant women. So the plan we will suggest to Mr. WW will be valproate, as the patient has increased level of AST and ALT, and this valproate helps him to treat bipolar disorder and help Mr. WW to quit alcohol, controlling his withdrawal symptoms. But valproate, as we know that, is metabolized by liver, so we can also use topiramate as adjunct if patient do not completely respond to valproate. From the above discussion, we have concluded that alcohol misuse can lead to well-damaging chronic abnormalities and conditions, and patients become more and more dependent on alcohol with the time. So to treat the condition, we have drugs like disulfiram, naltrexone, acamprosate. Along with these, we can also use some adjunct treatment and multivitamin depending on the symptoms person develop. I have mainly covered all of these topics from book Coda Kimball. The other references are also given here.